Hello everyone. We reached the last stage of the AI in Healthcare initiative by National Board of Examination in Medical Sciences. I take this opportunity to put my sincere gratitude and thanks to those people who made this visible. To start with, the Honorable Union Minister of Health and Family Welfare, the State Minister of Health and Family Welfare, Government of India, for the encouragement and support towards advancing medical education and healthcare excellence. I would also like to sincerely thank our President, Dr. Abhijat Seth, who without blinking said, go ahead and start this initiative. And this would not have been possible without the support of senior bureaucratic officers, the governing body members, and a special mention to Dr. Rakesh Sharma, who along with the team of dedicated NBMS staff made this visible. The leadership, guidance and commitment to strengthening the healthcare education and capacity building across India has truly reflected in shaping this project as one of the most successful things. This would not have been possible without the active and enthusiastic participation, commitment, and active engagement of all of you people, despite busy clinical, academic, and personal schedules. Together, we achieved this feat. 68,000 plus registrations and a Guinness World Record for the largest viewership live streamed on YouTube on the AI in Healthcare lesson. These are all good moments to cherish and remember. How is it possible? This was possible by the dedicated lectures given by our world-class faculty. When we requested them, without even a single thought, they said, yes, we are there for this great cause. I may not be able to detail all the credentials of the great speakers across the world, but my sincere thanks and heartfelt gratitude to all of them who, without expecting even a single penny, took their time out and then just spent on every Wednesday. This started with a big bang by none other than Dr. Nageshwar Reddy, who is the chairperson of AIG Hospitals, who gave the introduction of AI in the medical professionals. This was followed by one of the most sought after and patent protected person on the mathematics and statistics, which is by Kishore Dhara and moderated by Neil Ghosh. That was followed by the types of clinical data and asking the right questions, where we learned Professor Dr. Fanindri Yalavarthi from IISc Bangalore elaborating so beautifully and moderated equally eloquently by Dr. Anurag Agarwal. Then the biggest question, how to handle the missing data and how to understand unstructured data. One of the toughest topics made so easy by Professor Dr. Seema Singh and Mr. Parag Agarwal. This was followed by the most interesting and probably the most questioned the session is prompt thinking, how to give prompts to the AI so that we end up in getting the right answers. That was followed by module 6 with the big bang, the Guinness World Record attempt, is AI in healthcare, why machine learning and when not to use it. This was followed by another great lessons on the AI, the machine learnings and deep learnings, covered by eminent personalities, Dr. Sumit Singh, and then followed by Dr. Mahesh Balan, moderated by Sirpani, and then deep learning by Neil Ghosh, moderated by industry expert Ravi Bharadwaj. Again, that brings to the best memories, that is AI in Healthcare by Dr. Anurag Agrawal. The Guinness World Record establishment was moderated by one of the Harvard eminent speakers from US, Chandra Lingi Shetty. This was again followed by model evaluation by one of the famous scientist, physician, and academician, Dr. Rahul Kashyap, who worked with Mayo Clinic and best of the institutes in the US, moderated by Dr. Devyani Mahapatra from Harvard University. This was again followed by Beyond Metrics, how to use it practically, by Kiran Avancha and Kamala Avancha from the Arizona State University. That was followed by the lifetime experience on how to evaluate the retrospective data. You can't get a better person than Dr. Anguraj Sadanandam, who actually very precisely told on how retrospective data can be used to make a prospective decisions. Moderated well by Dr. A.V.S. Prakash, again a professor from IIM Lucknow, who is instrumental in designing this curriculum along with the other experts from the national board. This was followed by one of the very, very lucid, completely doctor-oriented lectures by Professor Purvesh Parekh and moderated by Dr. Raghunath Rao on bias. How AI will get biased. This was followed by Black Box versus White Box by eminent speaker Shrikant Sampara, moderated by Dr. Ashwin. Then, how to understand the algorithmic fairness, spoken by Dr. Avnish Khare, one of the eminent medical educators, moderated by Dr. Rajiv Sharma. Then comes the most dilemma, that is ethics in AI, supposed to be co-moderated by one of the most eminent personalities in bioethics, Dr. Russell, but unfortunately because of the prior engagements, it was taken by Dr. Raghunath Rao, very well appreciated, moderated by Kalyan, who is a genetic expert. That was followed by one of the best masterpieces you can get from the industry, spoken by Parminder and moderated by Rakesh Malik on wearables, robotics, software as medical device. This was followed by a smart journal reading. Here we are fortunate to have the ethics of publication spoken by none other than Russell D'Souza, and the module was taken by Nitin. This was followed by cybersecurity, data privacy, by one of the most eminent personalities, Mr. Ravi Puwala, who is the CEO of the Quantum Biosciences, moderated by Subakar. And last, the blistering lecture, and probably one of the best people who initiated the digital health in India, by Rajendra Pratap Gupta sir, moderated by Venkateshwar Mahadeva. So this is the enriched modules that we went through. And I can't ask more than this. And I am sincerely grateful for the thousands of feedbacks that we got it from all of you people. Your suggestions have helped us continuously improve each subsequent session. We know that we started with some lacunae, but we try to fulfill them as we move on. Based upon the popular request, we are finishing everything well before June 17th. Coming to the last portion, which is most important, that is how to get the certificate. For the purpose of obtaining the course completion certificate, a registered participant must have attained at least 75% of the attendance in online live lectures and should qualify for the summative assessment. The assessment shall be administered on completion of all modules and will comprise of 50 questions of multiple choice with single best answer, or it could be a true-false type. The summative assessment can be completed in 1 week. You have all the time, but you have only 3 attempts. You should be able to score at least 50% of the marks. That means 50% answers should be correct. The link to summative assessments for the purpose of the course completion certificate shall only be visible to the eligible participants. If you are not seeing, that means your attendance is less than 75%. Do we want to disrespect those people? Never. Our intention is learning and teaching, right? So for those people who unfortunately missed the 75% mark of the attendance, but still attend 60% or more attendance are eligible for the certificate of participation, not course completion. The question papers were prepared based on the lectures by the faculty and moderated by myself. I hope this is going to give a clarity on how to download your certificates. And I take this opportunity once again to thank each one. I could not name many of them who really came forward to help in shaping this great initiative. But my heartfelt gratitude and thanks to each one of them. And I'm sorry if I forgot to mention any of those names. Have a good day. Good luck. Download your participation certificate or course completion certificate based upon your eligibility. Signing off, Dr. Suresh from National Board of Examination Medical Sciences.